Pharmacology. CVS drugs. So starting with problem. Problem is with decrease. We have to decrease the fluid because fluid increased. So we will give diuretic drugs. Number 2, we have to increase pumping. For pumping we have Inotropics. So what we give in diuretics? Diuretics actually we have two types, which it will work in loop of Henle, so it's called loop diuretics, and there are thiazides. Thiazide diuretics. Loop diuretics are strong and short acting. Thiazide diuretics are weak. And long acting. So that's why according to their property we use them in different diseases. So the loop diuretics will be used in congestive heart failure, and thiazide diuretics will be used in hypertension because it will work one tablet for whole day. That's why it's short acting and long duration, weak acting but long duration. But these both have some side effects. What side effects they produce? They decrease sodium level from blood because sodium will be lost in urine. They will lose sodium. They will lose potassium also, and also they will lose H plus. They will lose magnesium also. But something they will gain. What they will gain? The gain will be they will gain sugar, they will gain lipids, they will gain uric acid. But both of them have different action on calcium. What are the different action of calcium? Remember loop, L for loop, lose, thiazides gain. So they will lose calcium, so in the body there will be less calcium. Loop lose, L to L. Thiazide they will gain calcium. So this is how cardiovascular diuretics will work. Now inotropes. How the inotropes will work? Inotropes actually they will work on receptors. So and some they will work on metabolism of the cardiac cells. In the receptors, first receptor we have beta 1. They will excite beta 1. some drugs dopamine, dobutamine, noradrenaline and adrenaline, non-adrenaline and isoprelin. But the problem is only dobutamine is beta 1 selective. That means it only works in beta 1. But other all this they works in beta 1, but with those beta 1 they works in some other receptors also. Dobutamine works on D1 and alpha 1, all the one. The non-adrenaline will work on alpha 1 and alpha 2. Beta 1 they will work, all this one will work on beta 1, but plus they have in isoprelin also it will work on beta 2. So dobutamine it works in beta 1, D1 and alpha 1. Dobutamine works on beta 1 only. Non-adrenaline works on beta 1, alpha 1, alpha 2. Isoprelin works on beta 1 and beta 2. Now next mechanism. In second we will block some receptor PDH. What is this PDH? Phosphodiesterase inhibitor. How this phosphodiesterase work? Imagine this is a heart cell. In this there is a receptor. This is beta 1 receptor. This is activated. Now when the receptor activates, they will give signal to G protein, and G protein will break down into two halves. One half which will initiate CAMP. This CEMP will go and phosphodiesterase and give this to phosphodiesterase. What it will do? Phosphodiesterase will work on vessel, and this phosphodiesterase if we inhibit, so vasoconstriction will decrease, so fluid load will lower the fluid load. So this works as inotrope, or rather it's called inotropic effect, and vasodilation. There are two drugs. One amyrilone and milrinone. PDH blockers are amylinone and milrinone. Third thing, this is very dangerous drug. which only used in ICUs, Digoxin. Rather, it is a group of Digitalis. There are, okay, what is this? This is a cardiac glycoside. What is cardiac glycoside? Okay, again we'll see a heart cell but with more organelles. Let's draw some receptors. Pumps. There is a sodium pump, sodium potassium pump. Sodium in the cell increased so they will throw sodium outside and they will take in potassium. So this is called sodium potassium pump. Another pump is there which will bring sodium inside. This is a symport pump, and this is also using ATPase. Sodium and calcium. They will bring sodium in and put calcium out. And there is one more special pump which brings only calcium in. In the endoplasmic reticulum, there is sarcoplasmic reticulum. In sarcoplasmic reticulum, there is a receptor called as SERCA, which is ceruloplasmin endoplasmic reticulum, calcium ATPase. What it does, this sarcoplasmic reticulum, they have thousands and thousands of calcium. Activation of this will lead this calcium out, but after the work has done, they will take back the calcium. In digoxin drug, what it will do, they will block this receptor, this pump, sodium potassium pump. They will block this exchanger, sodium calcium exchanger, and they will activate here one receptor called ranitidine receptor. This ranitidine receptor will not allow this calcium to come back. So what is happening? Calcium is coming in from one side. Let's imagine there is 10 calcium and this is giving 1000 calcium. So every time 1000 plus 10, 1010. In the next beat 1000 is still remaining, 1010 is remaining. They block this calcium, so calcium is not going outside. Again 10. So first it will become 1000, 1010, 1020. So what it will lead? It will increase the contractility. So what are the mechanisms how it's increasing? First they will block sodium potassium pump. Second, they will block sodium calcium exchanger. Which will lead to increase calcium in cytoplasm. So this increased cytoplasm and from the sarcoplasmic reticulum, they all together will increase the contractility. This is the mechanism of action. Now, they have some characters which is called vagomimetic. Effect. What is this vagomimetic effect? This is parasympathetic reflex which will decrease HR, heart rate, which will decrease conduction. So that's why this is used as in the disease atrial fibrillation. Now we'll learn about Digitalis drugs. Digitalis, there is two drugs, which is Digoxin and Digitoxin. Digoxin, it works on kidney. Digitoxin works on liver toxin. Maximum toxin works on liver. So they have two contraindications. What are the contraindications? Contraindicated in kidney failure. And this one contraindicated in liver failure. Now this digitoxin drug, this has been withdrawn from market. Digoxin still is there use. This have some side effects. What are the side effects? Most common side effect is nausea, vomiting. Second side effect, it can cause arrhythmia because calcium will increase and increase the contractility. Most common arrhythmia. It is the most common arrhythmia caused by digitoxin is ventricular bigemia. But more specific, or rather you can say more characteristics, is NPAT with AV block. This NPAT, non-paroxysmal arterial tachycardia. This drug can also do gynecomastia. Also do xanthopsia. What is this xanthopsia? Yellow vision. Gynecomastia. We have to remember something about gynecomastia. Disco. What is this disco? Gynecomastia. Disco are those drugs which can cause gynecomastia. This is digitoxin, isoniazid, spironolactone, clemetidine, and estrogen. Digoxin, isoniazid, spironolactone, cimetidine, and estrogen. Next we will see some drugs working on chronic congestive heart failure. Now what happened? Chronic, it's long time. We have to decrease the work of the heart. Decrease the fluid also. And third thing, in chronic congestive heart failure, we have left ventricular hypertrophy. So we have to decrease their left ventricular hypertrophy. Which one? Only the reversible one. So reversion of left ventricular hypertrophy. If you can correct these two things, this will reverts. So how we can decrease the work? By vasodilation. Will not allow lot of fluid to go into the heart. And for fluid, we have already discussed, we can give loop diuretics. It is short acting. Already the patient is in hospital, so we can use loop. Vasodilation. How we can do vasodilation? Imagine this is the heart. Blood is flowing into the heart, and heart have to pump the blood outside. So the blood before the heart, it's called preload, and blood going out is called afterload. Some drugs can decrease preload, some drugs we can use for afterload, and some drugs we will use in both. So what are the drugs which is acting on preload? Nitrates. Nitrates are the drugs which acts on preload. In the afterload, hydralazine. And in both preload and afterload, it can work. What is this? This nitroprusside, sodium nitroprusside. So how the sodium nitroprusside is working in both? By blocking ACE receptors and ARB, angiotensin receptor blocker, and in the lungs, angiotensin-1 converting enzyme, by blocking angiotensin converting enzyme. So how this thing is working? Normally what happens? Beta 1 receptor will go and give impulse to juxtaglomerular cells in kidney. Then kidney will produce renin. Next it will go and make angiotensin. Now angiotensin will convert this one. Angiotensin will go and it will become angiotensin 1, and this angiotensin 1 will convert into angiotensin 2 in lungs by angiotensin converting enzyme. Now angiotensin 2 is the vasoconstrictor, so it will go work on the angiotensin 1 receptors. These are the receptors on which they are working. Now this receptor will do vasoconstriction in the vessels, also lead to increase in adrenaline and non-adrenaline, impulsing more heart to constrict. By how? By aldosterone mechanism. Aldosterone will be released from where? Adrenal cortex. from the adrenal cortex. This is the kidney and this is the adrenal cortex. From the adrenal cortex, this aldosterone will be released. This aldosterone will cause left ventricular hypertrophy, leading to death. How it will increase? By increasing sodium absorption in the kidney and losing of potassium. With sodium, salt, water goes behind sodium, so water will be there, increased, edema will be done, decrease of potassium, and it will go decrease H plus ions also. So this is the mechanism. Beta 1 is giving to JG cells. Now what we can do? We can block beta 1. Second, we can block angiotensin-converting enzyme in lungs. Third, we can block angiotensin receptors. Fourth, we can block aldosterone. So block beta, block AC, block angiotensin receptor, block aldosterone. Beta blockers. Or we can say beta 1 blockers. Remember, all drugs ending with the name LOL are beta 1 blockers. Example: carvedilol, metoprolol, bisoprolol. Carvedilol, metoprolol and bisoprolol. Number 2, we have ACE blockers. Number 3, we have angiotensin receptor blocker. We'll talk this one little later. Let's talk about number 4 little, aldosterone blockers. Spironolactone. This used to be only drug which used to block aldosterone. New drug have came, name eplerenone. Why? What is the mechanism of action? This both of them, they have same mechanism of action. They work by potassium sparing diuretics. Both have side effect. Side effect of beta blocker is acute CHF. Sorry, not side effect, contraindicated. This is contraindication. Should not be given in acute side effect, acute chronic heart failure. It will go to hypotension. Now AC inhibitors. AC inhibitors they have ending pril. After this, captopril, lisinopril, enalapril, ramipril, prendopril, moxapril. Captopril and lisinopril. They have some features which you can remember with cap, and the other they have some features. So all these features you can remember with captopril. Cap is for only these two. So they have dry cough. Angioedema. These are prodrugs. And this all they can change taste alteration. Those are orthostatic hypotension, can cause orthostatic hypotension. PRI. These three are contraindications. What are the contraindications? They are not given in pregnancy. They are not given in bilateral renal artery stenosis. And the third one, they increase potassium, so contraindicated in hyperpotassiemia. L, they have low risk. For whom? Low risk for diabetic nephropathy. So we are done with AC. Now we are remaining with angiotensin-1 receptor blockers. Angiotensin receptor blockers, they end with sartan, low sartan, valsartan, telmisartan, irbesartan, iprosartan, and candesartan. From all this, telmisartan, this have one more action, PPAR, gamma activator. What is this used? This reverse insulin resistance. How it reverses insulin resistance? With this excitation of this receptor. So this is used in diabetics, hypertension with diabetes. So you can remember one more thing with the name of sartan. S for selective angiotensin receptor, antagonist. Some new drugs. New drugs will do in the next video.